Fire. What is it about those flickering flames that has captivated humanity for millennia? Is it the warmth, the light, or perhaps the sheer power of transformation? Now imagine this. What if that fascination turned into something uncontrollable? A compulsion to set fires, not for gain or revenge, but just to feel alive, to quiet an internal storm. What would that mean for the person, their loved ones, and their community? Welcome to MedHeads, where we explore the intricate threads of health and medicine. Today, we're diving into the rare and often misunderstood world of pyromania, an impulse control disorder that's as perplexing as it is uncommon. Stick around as we explore the science, the stories, and the strategies for understanding and addressing this fascinating condition. So what exactly is pyromania? According to the DSM-5, it's defined by repeated and deliberate fire setting. But it's not just the act of setting fires, it's the emotional buildup and release that distinguishes pyromania. Before the act, there's an intense inner tension, like a coil wound too tightly. During and after the fire, there's an undeniable sense of gratification or relief. This isn't about profit, covering up a crime, or seeking revenge. People with pyromania set fires for the experience itself. It's almost as though the flames reflect their internal chaos, a physical manifestation of what they can't put into words. Let's take a moment to imagine what life might feel like for someone living with this disorder. Picture a young man, maybe 17 or 18 years old. He's sitting at home, feeling a wave of tension he can't shake. It's not anger, it's not sadness. It's something deeper, an itch that no amount of pacing or distraction can scratch. He walks outside, finds a secluded spot, and strikes a match. For a moment, he watches the flame dance at the end of the matchstick. His heart races, but not in fear. It's almost exhilarating. He lights a pile of leaves, and as the fire grows, that unbearable tension starts to melt away. He feels calm, almost euphoric. Now, imagine the aftermath. He might feel ashamed or confused about why he needed to set that fire. Or maybe he's already thinking about when he'll feel the need to do it again. That's the insidious nature of pyromania. It's a cycle that feeds on itself. The compulsion often starts in childhood or adolescence, sometimes as young as 10 or 11. These individuals are frequently drawn to the tools and settings associated with fire: matches, lighters, campfires. But the act isn't random. It's purposeful. They may prepare for days, choosing a location where they can watch the flames without being caught. A real-life example. In one documented case, an 18-year-old male with pyromania showed an abnormal pattern of brain activity, specifically in the left inferior frontal region. This finding led to a combination of cognitive behavioral therapy and medication that significantly reduced his urges. After just a few weeks, his compulsion to set fires had subsided completely. It's a powerful reminder of how far we've come in understanding the brain's role in disorders like this. For clinicians, recognizing the signs of pyromania can be tricky. Most individuals who set fires don't meet the criteria for the disorder. For example, a study of arsonists found that only a tiny fraction, about 3%, had true pyromania. That's why a thorough history is crucial. Treatment often involves cognitive behavioral therapy to help individuals recognize their triggers and develop healthier coping mechanisms. In some cases, medications like mood stabilizers or anti-anxiety drugs may be effective, particularly if there are comorbid conditions like depression or ADHD. Here's something to think about. If someone in your community showed signs of an impulse control issue, whether it's fire setting or something else, how would you react? Would you offer support, or would fear and misunderstanding take over? It's a tough question, but an important one. As rare as pyromania is, it holds a mirror to our understanding of impulse control. What's happening in the brain that makes some people more vulnerable? And how can we harness this knowledge to develop better interventions? That's where future research comes in. Advances in neuroimaging and psychotherapy could open doors we can't even imagine yet. Until then, education and empathy remain our most powerful tools. Thank you for joining us on this exploration of pyromania. Remember, MedHeads is created by meducate.com.au, where you can find courses and content for health professionals. Stay curious, stay compassionate, and let's keep sparking meaningful conversations.